let's first look at the principle of diffusion, which is the very basis of dialysis. So what is diffusion really? In very, very simple terms, so that you can understand diffusion, it is simply a mass transfer of molecules which occurs from a high concentration gradient to a low concentration gradient. So we know that the blood in the dialysis patient has very high levels of urea, creatinine, phosphates, and many other molecules. And we want these to be removed into the dialysate, which has absolutely no concentration of these molecules. And that is the basic principle of dialysis, which is diffusion. Interestingly, the dialysis blood flow rate is in one direction, and the dialysate flow, however, is in the counter current direction. And this is the basis for this counter current flow of dialysate, so that maximum number of molecules are removed, because at any point of time, the dialysate will have minimum concentration of these solutes. So we've learned about diffusion, in which the molecules are moved across the semi-permeable membrane through the pores, and they are being removed into the dialysate. But sometimes this is not sufficient, and we need to remove more and more of the middle molecular weight molecules also. And this is done with the help of convection, in which there is a transmembrane pressure or a pressure gradient created across the membrane. And this forces some of the molecules which are of middle molecular weight, as well as certain other molecules, to move across the membrane, although the pore size may not be sufficient. And so, with the help of convection, we can remove even more number of the molecules that we want to remove from the blood. And this is done with the help of ultrafiltration. So this convection and diffusion together form a large part of the dialysis as we know it. Convection depends on a higher pressure gradient along the length of the dialysis membrane, which means that you may be tempted to increase the ultrafiltration rate of a patient. But there should be caution. So if a patient comes to you and says, I have gained 4 kgs of weight during my 2 dialysis episodes, and please remove it for me, you should have a slight caution here, because it may cause hypotension in the patient. And therefore, although higher pressure gradient will remove a large number of the molecules, we must use it cautiously. The second factor is blood viscosity, which depends on hematocrits. And for this, we must maintain the hemoglobin of our patients on dialysis, so that blood viscosity is maintained, and thereby we get a higher removal of the molecules of urea, creatinine, and other molecules. And that is why you must monitor monthly which of your patients is having anemia, which of the patients is doing well in terms of hemoglobin levels. Also, a higher blood flow rate will also ensure greater convection. In Asian population, however, the blood flow rate usually doesn't go more than 300 ml per minute. In the Western population, because they are better built than us, sometimes the blood flow rate can be increased to up to 400 ml per minute or even more. But in India, particularly, we achieve usually blood flow rates of 250 to 300 ml per minute. I would encourage technicians to increase the blood flow rate as much as possible safely, so that the venous fistula or the AVF that is there in the patient is used optimally. We don't want it to collapse either. And of course, if there is a smaller diameter of individual hollow fibers, it means that there will be more surface area, and thereby there will be more removal of the molecules that we want. And then we come to the concept of adsorption. So what is adsorption? Like the video just showed you, the protein molecules get attached to the semi-permeable membrane. And however, these then cause activation of complement. How? When the protein molecules get in touch with the semi-permeable membrane material, which is synthetic, of course, then what happens is that they get activated and a whole complement cascade is activated. So there may be coagulation or fibrinogenic reactions. The cellulose acetate membranes, which we used earlier, made of cotton fibers, usually had a very strong protein absorption, and therefore they are no longer used. And now we use the more synthetic polysulfone and other types. And in these, there is a hydrophilic membrane which is used. So how is it made hydrophilic? Hydrophilic means the water permeability is increased and there is lower protein adsorption. And in this, there is addition of PVP, that is pyrovinyl pyrrolidone. And because of this feature, hydrophilic feature, there is lower protein adsorption and the membrane doesn't get clogged with protein. Otherwise, if the membrane gets clogged with the protein, the pores are obstructed, and this is also known as membrane fouling, which we don't want to occur.